There is a man in his early 40s standing in his kitchen on an ordinary Tuesday morning, pouring coffee, half listening to the news, when he notices something strange. A faint ringing in his ears, high-pitched, almost like a distant whistle that seems to come from nowhere and everywhere at once. He shakes his head, blinks, and it fades. He shrugs it off as too much caffeine, or maybe not enough sleep, and goes about his day. He has no idea that this momentary, forgettable sound was his body trying to tell him something urgent, that somewhere inside the silent architecture of his blood vessels, pressure has been quietly climbing for months, perhaps years, and that this ringing was simply the first whisper of a disease that kills more people every year than almost any other condition on Earth, precisely because it so rarely announces itself the way people expect a serious illness to announce itself. There is no dramatic collapse, no searing pain, no moment of obvious crisis. There is only a series of small, easily dismissed signals scattered across the body, waiting to be noticed by someone willing to pay attention. This is the story of those signals, and of why so many people walk past them every single day without realizing what they are looking at. High blood pressure has earned itself a particular nickname among physicians, one that captures both its danger and its deception in 3 simple words: the silent killer. It is silent because, unlike a broken bone or a stomach virus, it does not typically produce pain that forces a person to stop what they are doing and seek help. It is a killer because, left unaddressed, it methodically damages nearly every major organ system in the body: the heart, the brain, the kidneys, the eyes, often over years or decades, until one day a heart attack, a stroke, or kidney failure arrives seemingly out of nowhere, when in truth, it was never out of nowhere at all. It was the predictable, almost mathematical result of pressure inside the arteries that had been too high for too long. The scale of this problem is difficult to overstate and almost impossible to intuit from daily life, precisely because the disease causes so little visible disruption to the people carrying it. Public health researchers estimate that well over 1 billion adults worldwide live with high blood pressure at any given time, a figure so large it becomes almost abstract, easier to grasp, by considering that in many countries, including some of the wealthiest and most medically advanced in the world, close to half of all adults meet the clinical threshold for the condition at some point in their lives. And among that staggering number, a substantial proportion, by some estimates close to half, remain completely unaware that they have it, walking through ordinary days, raising children, working demanding jobs, exercising, eating dinner with friends, all while carrying a slow, structural process inside their blood vessels that they have never once been told about, because nothing about how they feel has ever prompted the conversation. This is the strange, almost unsettling paradox at the center of this disease. It is simultaneously one of the most common chronic conditions on the planet, and one of the most chronically underdiagnosed, not because the test to detect it is difficult or expensive, but because so few people ever think to take that test until something else, something unrelated, sends them to a doctor's office in the first place. To understand why this happens, and why the warning signs are so easy to miss, you first have to understand what blood pressure actually is, stripped of medical jargon, reduced to its simplest physical reality. Every time your heart beats, it pushes a wave of blood through your arteries, and those arteries, if they are healthy, expand slightly to absorb that wave, then relax again between beats. Blood pressure is simply a measurement of the force that wave exerts against the walls of those arteries, expressed as 2 numbers: the systolic pressure, which captures the force during a heartbeat, and the diastolic pressure, which captures the force during the brief rest between beats. When those numbers creep upward, when the force against the artery walls becomes chronically elevated, the arteries respond the way any material responds to sustained, excessive stress. They stiffen, they thicken, they lose the flexibility that allowed them to absorb the force of each heartbeat gracefully. A stiffened artery is a less forgiving artery, one more prone to injury, more likely to develop the fatty plaques that can rupture and trigger a heart attack or stroke, and more likely to gradually choke off blood flow to organs that depend on a steady, well-regulated supply. This is the slow mechanical story unfolding inside hundreds of millions of people around the world right now, most of whom have no idea it is happening because the early stages of this process, almost by design, do not hurt. And yet, the body is not entirely silent. It rarely is. Before turning to the signs themselves, it is worth pausing on a question that quietly underlies all of them. Why does blood pressure rise in the first place in someone who feels otherwise completely healthy? The honest answer is that, in the vast majority of cases, there is no single cause, no one villain to point to, but rather a slow convergence of multiple contributing forces acting on the same vascular system over years. Genetics plays a meaningful role, with a family history of high blood pressure substantially raising an individual's own risk, regardless of their personal habits. A reminder that some people are working against a biological headwind that others simply do not face. Diet plays an equally significant role, particularly the steady, often unnoticed accumulation of sodium in modern processed and restaurant food, an ingredient the kidneys must work to excrete, and one that, when consumed in excess over years, encourages the body to retain extra fluid, increasing the total volume of blood the heart must push through the system with every beat. Chronic stress contributes as well, not through any single stressful event, but through the cumulative effect of a nervous system that spends too much time activated, releasing stress hormones that constrict blood vessels and elevate heart rate far more often than the body was ever designed to tolerate. Excess body weight strains the cardiovascular system directly, requiring more blood vessels to supply more tissue, while also disrupting the delicate hormonal signaling that normally keeps blood pressure within a narrow, healthy range. Sedentary living removes one of the body's most effective natural blood pressure regulators, since regular physical activity helps blood vessels remain flexible and responsive, rather than stiff and reactive. And aging itself plays a quiet, inevitable role as the elastic fibers within artery walls gradually lose some of their flexibility over decades of use, a process that affects nearly everyone to some degree, but accelerates dramatically when combined with the other factors already described. None of these forces, on their own, fully explains why one person develops dangerously high blood pressure, while another, eating a similar diet and living a similar life, does not. But together, accumulating quietly across years, they explain why this disease has become so extraordinarily common, and why the warning signs that eventually emerge, the ones at the center of this story, deserve so much more attention than most people are ever taught to give them. The ringing in that man's ears was the first thread of this story, and it belongs to a phenomenon doctors call tinnitus, a perception of sound, often high-pitched ringing, buzzing, or whooshing, that exists only in the listener's own head. While tinnitus has many possible causes, learning to recognize the signals the body does offer, faint as they often are, can be the difference between catching this disease while it remains easily manageable and discovering it only after it has already caused irreversible harm. Researchers have observed a notable association between elevated blood pressure and the kind of pulsatile tinnitus that seems to throb in time with the heartbeat, a pattern that makes physiological sense once you consider what is happening just behind the eardrum. The inner ear is supplied by extraordinarily small, delicate blood vessels, among the smallest and most sensitive in the entire body, and when blood pressure rises, the increased force and turbulence of blood flow through those tiny vessels can become audible to the very structures designed to detect sound, creating a perception of noise that has nothing to do with the outside world, and everything to do with the pressure of blood being forced through vessels never meant to handle that much force. Most people who experience this kind of ringing never connect it to their blood pressure at all. They blame loud concerts, allergies, or simply getting older. And in many cases, those explanations are perfectly reasonable. But when that ringing arrives suddenly, persists, or seems to pulse in rhythm with a heartbeat, it deserves a second look, because it may be one of the earliest, most accessible windows the body offers into what is happening deep inside its vascular system. From the ears, this story moves naturally to the eyes, because few organs in the human body reveal as much about blood vessel health as the delicate structures lining the back of the eye. Ophthalmologists have long understood that the retina functions almost like a window into the body's entire vascular system, since the blood vessels visible there during a routine eye exam are structurally similar to blood vessels found throughout the rest of the body, just far easier to observe directly. When blood pressure rises and stays elevated, it can produce a condition called hypertensive retinopathy, in which the small blood vessels of the retina narrow, leak, or develop telltale changes that an eye doctor can often spot before a patient has any idea anything is wrong. Some people with significantly elevated blood pressure report subtle visual disturbances, a sense that vision has become slightly blurred, or the appearance of small, fleeting spots or shadows that seem to drift across the field of view, particularly when blood pressure spikes suddenly and dramatically. These visual symptoms are easy to dismiss, attributed to fatigue, to staring at a screen too long, to simply needing new glasses. And indeed, in isolation, they often are perfectly innocent. But because the eyes offer such a direct, visible reflection of vascular health, a routine eye exam has increasingly become an unexpected early warning system for blood pressure problems that have not yet been diagnosed anywhere else, with optometrists and ophthalmologists in many cases being the first medical professionals to notice the telltale vascular changes and refer a patient for blood pressure evaluation before any cardiologist or general physician has ever measured it. Moving downward from the eyes and ears toward the head itself, we arrive at perhaps the most commonly recognized, yet still widely misunderstood, warning sign of all: headaches. Most people carry an intuitive assumption that high blood pressure causes headaches. Physicians and public health researchers have repeatedly emphasized this point because it cuts against a deeply human instinct, the instinct to wait for the body to tell us, clearly and unmistakably, that something is wrong before we seek to address it. High blood pressure, more than almost any other common chronic disease, violates that instinct entirely. It can be present, doing real and accumulating harm, in a person who feels completely fine, who has no ringing in the ears, no swelling in the ankles, no fluttering in the chest, nothing at all that would prompt a visit to a doctor on its own. This is why regular blood pressure checks, whether at a doctor's office, a pharmacy, or increasingly through inexpensive home monitors that have become remarkably accurate and affordable in recent years, have become one of the most quietly powerful tools in modern preventive medicine, capable of catching this disease at a stage when it remains almost entirely reversible through manageable changes in diet, physical activity, sleep, and, when necessary, medication. Home monitoring in particular has changed the landscape of early detection in a way that deserves more attention than it typically receives, allowing people to track their numbers over days and weeks, rather than relying on a single reading taken during the often artificially stressful environment of a medical appointment, a phenomenon well known to clinicians as white coat hypertension, in which the anxiety of being in a doctor's office temporarily elevates readings beyond what a person's blood pressure actually looks like during ordinary daily life. A handful of home readings, taken consistently over time, often paint a far more accurate and useful picture than any single number captured during a rushed 15-minute appointment, which is part of why so many cardiologists now actively encourage their patients to monitor at home rather than relying solely on occasional clinical visits. What makes early detection so valuable, beyond simply satisfying curiosity about a number, is how much can actually be done once high blood pressure has been identified. Particularly, regular monitoring matters more for some people than others, even though it remains valuable for everyone. Age is perhaps the most universal risk factor. since the gradual stiffening of arteries described earlier in this story affects nearly everyone over time, making blood pressure something that tends to climb steadily across the decades of adult life, even in people who do everything right. Family history matters enormously as well, with research consistently showing that people whose parents or siblings developed high blood pressure face a substantially elevated risk themselves, a reminder that genetics loads the dice even before lifestyle enters the picture. Certain populations face disproportionately higher rates and earlier onset of high blood pressure, a pattern researchers attribute to a complex combination of genetic factors, disparities in access to consistent healthcare and routine screening, and the broader social and economic conditions that shape diet, stress, and opportunities for physical activity across different communities. Pregnancy introduces its own distinct version of this risk, with some women developing a condition called preeclampsia, a sudden, dangerous rise in blood pressure during pregnancy that requires immediate medical attention, and that can also serve as an early warning of elevated cardiovascular risk later in that woman's life, long after the pregnancy itself has ended. None of these risk factors guarantee that any individual will develop high blood pressure, and none of their absence guarantees safety either. But together, they help explain why public health guidelines increasingly recommend that blood pressure checks become a routine, unremarkable part of adult life, woven into annual checkups, pharmacy visits, and even workplace wellness programs, rather than something reserved only for people who already suspect something might be wrong. When it is caught before it has had years to reshape the heart, kidneys, or blood vessels. For many people with mildly to moderately elevated readings, meaningful improvement begins with changes that sound almost deceptively simple, reducing sodium intake by paying closer attention to the hidden salt content in processed and restaurant food, increasing potassium-rich foods like leafy vegetables and fruit, which help the kidneys excrete excess sodium more effectively, engaging in regular moderate exercise, which research has shown can lower blood pressure by a clinically meaningful amount within a matter of weeks, improving sleep quality and addressing sleep apnea where it exists, moderating alcohol consumption, and finding sustainable ways to manage chronic stress. For those whose blood pressure remains elevated despite these changes, or whose numbers are high enough to warrant immediate intervention, decades of pharmaceutical research have produced an extensive and well-understood toolkit of medications, each working through a different mechanism, some relaxing blood vessel walls directly, some reducing the volume of fluid the heart must pump, some blocking specific hormonal signals that drive blood vessels to constrict, allowing physicians to tailor treatment to an individual's specific physiology with a level of precision that simply did not exist a few generations ago. The combination of these lifestyle and medical tools has made high blood pressure, despite its fearsome reputation and its very real capacity for harm, one of the more controllable chronic conditions in all of modern medicine, provided it is identified while there is still time to act, which brings this story back, full circle, to the simple, unglamorous act of checking. There is, in the end, something almost poetic about a disease this dangerous being so thoroughly undone by something this simple. Unlike so many of the great medical challenges of our time, conditions whose underlying mechanisms remain mysterious or whose treatments remain elusive, high blood pressure is, in most cases, both easy to detect and highly responsive to treatment once it has been identified. The man in his kitchen, hearing that faint ringing on an ordinary Tuesday morning, had no way of knowing what it meant, and perhaps, in his particular case, it meant nothing at all. But for millions of people around the world experiencing some combination of the signs woven throughout this story, that faint, easily dismissed signal is the only invitation their body will offer before the silence resumes, before the slow work of damage continues, uninterrupted for another year, another decade, until it finally announces itself in a way that can no longer be ignored. The signs are there, scattered quietly across the body, waiting not to be felt more intensely, because in most cases they never will be, but simply to be noticed, taken seriously, and followed just once to the simple act of finding out what the numbers actually are.